Hi, everyone. Thank you for tuning in. It's been 6 years since I had the opportunity to spend a little time with Dr. Soliman, who at that time, 2016, was the president of ASDA. He's now in private practice in Seattle. What's happened in your life and why private practice, and of all places, the beautiful rainy city of Seattle?
Yeah. I can't believe it's been 6 years, honestly. I look at the clock and I feel like we just had that chat, literally last week. A lot has happened. It's kind of funny. Last time we spoke, I was planning on pursuing general dentistry and I was going to, get involved in that. And it was I'd always had this passion for oral maxillofacial surgery. I kind of just loved it. I loved the surgery. I loved kind of the more medical aspect to it. The more involved that, just the surgeries in general were just so cool. So huge pivot kind of in my career since we spoke. Ended up getting accepted to University of Buffalo for the oral maxillofacial surgery residency. Finished my time there, and then so you talk about kind of how I ended up in Seattle and in private practice. The program I went to, and I got to speak, kudos to the University of Buffalo. It was very well rounded. We had a new department chair, Dr. Michael Markwicks, who brought in with like a huge craniofacial head and neck cancer. So, I was neck deep in these enormous surgeries and 16-hour surgeries. We'd be living in the hospital for weeks on end, trying to take care of these patients afterwards, very complex patients. And so after I got done, I kind of thought I wanted to pursue that avenue, and God bless anyone who does it. But I realized that maybe this isn't the best life for me. And so there's other facets of oral surgery that I truly enjoyed, including the dental-alveolar, orthognathic. So I actually, and this speaks to the power of social media. The job that I actually got in Seattle was through an oral surgeon, Ben Johnson, who has a relatively large Instagram following. And I kind of just texted him like, hey, do you mind if I come see you out in Seattle? I just want to come shadow. He wasn't looking for a job at the time. We linked up, and then a year later, we clicked. He liked me. It gave me plenty of opportunities out here for growth, hopefully future partnerships. So it just made sense for me to pursue that private practice route versus, some of the more DSO organizations. There isn't quite as much of an opportunity for oral surgeons to partner and grow themselves, business wise. So to me, it seemed like a good deal. When I graduated University of Washington, I swore I'd never come back because of the rain. I ended up falling in love and marrying a girl from Snoqualmie. It's kind of close to Seattle. And when she said, in terms of like moving back, when we had our daughter, we want to be close to family. So here I am, came back to Seattle. And I got to tell you, life as an oral surgeon is definitely a lot better than life as a dental student when you're back in Seattle. So.
Or an oral surgeon resident. I think that was.
No, that's not, I don't even talk about that. That's a PTSD memory I kind of locked away, and I don't ever want to pursue that. But yeah, so that's a lot has happened in 6 years. It's an honor for you guys to have me back. I always enjoy our discussions. Last time it was very fruitful, and I'm excited to chat more with you about what you've seen evolve in the last 6 years, and just how dentistry as a whole, and if we've made any strides since we last spoke as a community or as an organization or even as a profession to address some of the issues.
It is said that during the last 2 years, maybe 10 years of technology advancement because of COVID. Just technology has advanced. We know that in dentistry, same-day dentistry has gone through the roof. People just want to get done with one visit to the dentist. If they have to have some restoration, they don't want to go 2-3 times. They just want to get it done right away. Instant scanning versus impressions. How has your world, the oral surgery world, developed over the last 6 years?
Yeah. It's interesting because there's the field of oral maxillofacial surgery is so broad that, and it's the one thing I love about the field is that it extends into both medical and dental. So I remember just sitting when I went through doing some of the surgeries, some of the more complex traumas on that side. I remember, for example, like orbital floor fractures. Some people, you have to replace the socket of their eye with a metal sheet, and they had like CT guided surgeries where we actually can see real time where we're placing the metal titanium sheet versus kind of the direct visualization required in the past. Same thing with CT guided for a lot of the other stuff in terms of like when we were trying to do cosmetic surgeries, re-advancing or shaping people's cheekbones and just perfectly lining it up without even having to guess looking at it ourselves with the CT guided stuff. Also, just when we talk about some of the stuff I did in residency with the head and neck cancers with patients that we had to resect large portions of their jaws, And, we do this virtual surgical planning, which just blew my mind. Where literally from step one, we upload the CT scan, we plan all the parameters, print out cutting guides that are accurate within less than a millimeter. We literally, in terms of like where if we want to place implants in the leg, when we have the fibula, we replace it. That's all planned previously. Implant guides are all printed. And I remember watching the first surgery that I sat in. And this is something that really kind of gained steam in the last 10 years. And I remember watching it, like literally, even if you didn't know what you were doing, somebody could walk you through the entire surgery just because it's literally all planned that well for you. And then when I left that kind of more medical side, just to the dental side, I know we talk about like the one big thing in dentistry is like same day crowns, things like that, where patients can come in, have the crown prepped, printed, and literally they walk out with a brand new tooth. And on our side, one of the things that I loved is this, when patients come in with just where maybe their entire mouth just isn't restorable. And we can do the same thing with the CT guided, the planned, all that stuff to literally they can come in, take out all their teeth, put in 11 implants, and they can walk out with a brand new smile that's not a normal denture, but actually a fixed brand new smile. And so you talk about dentistry in a day. I mean, that's an entire new jaw in a day. So, it's phenomenal, just technology and where it's coming from. And I think some of the pushes too are just in the biomaterials, just the new membranes that are out, the new bone. Every year, I feel like there's something new that people claim, will bond faster, will integrate faster. The implants with some of the companies we work with, I mean, it's almost like you can't keep up to some extent.
Yeah, but it sounds very stimulating.
It is very stimulating, yes.
So I think 6 years ago, we spoke about the notion that there's a direct correlation between good oral healthcare and healthcare in general. You live a healthier life with good oral care. Costs less to maintain your standard of health. If you're treated for an issue, medical issue, or care, if you've had it, leads to better outcomes. So you're right in the center of this, being an oral surgeon, because actually you have one foot in dentistry, you have the other foot in medicine. How do you think this is progressing? And then maybe as a follow-on to that, what can we do to align oral care with healthcare in general?
I got to say, I think my eyes have definitely opened a lot more to this issue since we last spoke. I'd been kind of looking at it more from the dental side. There's some interactions you have with some of these patients and you talk to their primary care doctors, try to kind of organize the two sides together. But I think, like you said, just in the field that we're in, we're kind of blessed and it does make things a little bit more difficult, but we end up with dealing with a lot more of the sick patients, a lot more of some of the stuff that you say in underserved people with not really much access to healthcare. And I remember just being absolutely blown away at some of the stuff I saw in the hospital in terms of like dental care. I thought I saw some of the worst when I was in Seattle, but when I got to Buffalo, and that's not just in Buffalo, it's anywhere across the country, you have pockets that are like this. But I remember seeing patients that would from a simple, I got to tell you, Stan, I'm not lying. This patient, somebody who's poorly controlled diabetic, poorly controlled heart conditions, and they'll come in, that's their blood sugar is so uncontrolled that a simple dental abscess that on you and I, maybe a little bit of swelling, a little bit of pain, you go to a dentist, get some antibiotics, get a root canal, you're fine. These patients will sleep on it. And I literally saw these patients come in with imminent airway issues where they can't even breathe anymore. The swelling is so bad that and the abscess is so bad, they're now septic. So their entire body's shutting down. We take these people to the operating room. We literally end up having to perform tracheostomies on them, giving breathing tubes just so they can breathe past the abscess, end up in the ICU. We're controlling their blood sugars on insulin drips. These patients, some of the stuff will actually progress, and I don't mean to gross anyone out there, but literally the flesh-eating bacteria. These people will take 4 or 5 trips to the hospital, to the operating room, just for us to continue to debride and clean it all out. Whereas if this gentleman or this woman had just been seen a year or two earlier and just had seen a primary care doctor, had their blood sugar controlled, they would have never ended up with this hospital bill that's now upwards over hundreds of thousands of dollars, depending on how long their stay is. So, I mean, it was very shocking to me just what the system looked like. And it wasn't just that. I mean, we're talking just on the trauma sides, things that just a person with normal access would not be nearly as afflicted. One thing that I did appreciate more and I like there is that I felt from my time there that there was a little bit more of an eye opening on some of the medical doctor side, just about that correlation between the oral and systemic health. So we would have a lot of, other doctors that would call us and would say, hey, like, we have this patient on our service. we think that there may be possible dental relations to why their, their blood sugar is under control or their infections out of control, and they would actually call us to come in and see the patient. So there's more of that understanding. And I think for us to continue to progress as a whole, as healthcare, there has to be a continued communication between both sides. And I think that's a nice part about being where I am as an oral surgeon, is that we're able to facilitate when the dentist calls me, and then I'll call the primary care. We'll sit down, patients that are on chemotherapy, cancer treatments, I can sit down and have that intelligent conversation with someone and know how to properly treat their dental ailments, or vice versa. Patients that are undergoing cardiology surgery, they can come and talk to me, and I can set them up what's best for them. So very eye-opening, Stan. I got to tell you, it's almost like I lived a different life for 4 years during my time in Buffalo.
You think we're making progress as a society, and what can we do really to make the public aware? Because
it's like the $1 million question, right? I mean, I think, and that's the issue. I think with healthcare, and this is sad, there's just too much politics involved. And I think people forget that as a human being, people need help and they need to be treated. And the problem is, once money gets involved, once politics gets involved, now all of a sudden it's no longer about the patient, no longer about the issue. And I think that's the problem, is that there's just this continued divide. And I don't preach one way or the other. I don't care if it's Medicare for all or if it's private practice for all. I'm a fan of healthcare for all. I don't care how it's done. But to me, I mean, this system cannot maintain the strain it undergoes with simple things that could be treated so much earlier. And for them, and we saw it with COVID. COVID just pulled the blinds right off of everything. Just the overrunning the hospitals, nurses that were leaving because they're just underpaid, and then in terms of them, with the now taking up traveling and just in general with the healthcare stuff, patients that could have been and where they were in ASA 1 or a 2 or a 3, where they started getting more and more unhealthy, if they had just been stopped earlier, maybe COVID wouldn't have taken their life. And so it really was eye-opening again, and I think it lifted that shade and that veil off of the healthcare system in this country. So while we may have been making progress, I think having something as systemic and as widespread as COVID kind of really showed where we have room to work.
Yeah, I think we all have to advocate for the notion that everyone should have a primary care physician. And the issue is who pays for it. That's a political decision. But at the end, every American in the wealthiest country in the world should have access to a primary medical practitioner and a dentist. And the primary care practitioner and the dentist have to have the ability to communicate, portable electronic medical records, so that it's all in one place. And I'm afraid my generation has not done a good job. So we can journalize that, as we in the accounting profession say, to your generation. So
you're right. I mean, I would love for there to be a centralized EHR or some kind of documentation system that everyone has access to. It's very difficult. And it's not even, like I think you hit the nail on the head. Even communication is difficult, just across getting between different groups, different practices. It's tough. And I think if anything, it's been a little disheartening just seeing, when I got thrown in the trenches of it all, just kind of seeing where we are in healthcare. And I'm still optimistic as ever. I still think that, things can change and we can still make things better, but we have some work to do.
Well, I think, unfortunately, the next generation is going to have to do it. You're going to have it, and organizations like ASDA are going to have to speak up, I think, to the profession and say, this is what we as young people want. We want a healthier population, and we as dentists want to contribute to that. So,
right. I agree 100%. Yeah.
Have you stayed in touch with ASDA?
I have, actually. Yes, I've been. I'm actually heading out there this weekend for their annual session to give another talk. I gave a talk also in Chicago last year. I'm still pretty involved with them. Actually, when we talk about a little bit about technology and stuff, I'm excited to talk about some of the initiatives we're undertaking with technology as well. And I've been kind of directly involved with their technology group in terms of like expanding that area of the organization. So yeah, I've been in touch with them. Yeah,
that's cool. We're doing a lot of work with AI now. Able to scan through imaging and look for challenges that are hidden there in the patient's record, and bring it to the attention of the practitioner through AI. Just scanning through all the millions of extra images that are in there in these practice management systems. A lot of opportunity there.
Oh, 100%. My dad's actually a computer science professor, and he works in neural networks.
Oh,
Like, I
really?
remember he would sit down and have these riveting conversations with me of literally what you're saying, having the computer read through stuff, understand almost intellectually, and be able to kind of decipher and
Yeah.
figure out what, like if it's in healthcare, figuring out what's going on, having them interpret radiographs, interpret treatment plans, kind of to give you what the best percentage of success in certain situations. I mean, it's exciting, it's scary, and it's kind of like fun, like just fun to think about how far that field on its own is going to progress in the next even 10, 15 years.
Right. So, as somebody in private practice, where
Uh-huh.
I'm sure your day is heavily scheduled, do you find time to look at the technology?
Yeah, I actually, it's funny. When I'm sitting around, I'll look at like just random stuff on the internet, find out kind of where we are, what we progressed. Or some of my colleagues will send me cool things, on Instagram, Facebook, just social media in general. Just, hey, can you believe what's happening now? I mean, I remember that's how I found out about the robot, and I think it was in China that placed the dental implant completely on its own, no practitioner involved. And so it was, to me, it's just incredible where these things are headed. And I remember sitting also in Buffalo, they brought I always forget the name of it. I think it's the Yomi, or the robot, where they'd come in and they also do the same thing with the CT guided implant placement, where literally you can teach a monkey to place a dental implant now, and it's incredible. It's still very expensive. You know how technology always is at the beginning. It's kind of, but I think just as any, we saw ourselves. Like I remember when I was in undergrad, I actually worked on a E4D scanner for Henry Schein, and I actually was a little. I wasn't even a dental student yet. I was fabricating crowns, and just seeing where that E4D machine has now, what you guys have turned it into over the last 10 or 12 years, the speed, the technology, the scanning. I mean, it's a totally different ball game. So even things we have now will continue to progress to be faster, cheaper, and more economical.
Well, the latter is what you said is very important. I think the price of a DI scanner is coming down. The functionality is growing, and I think that we are very, very close to scanning becoming standard of care. The quality is really good.
Yes.
The price is coming down, and it's interoperably connected to the practice management system. So I think we're there. But firstly, I want to thank you for spending time with me again, and for because I know our team will watch us, and I think Dennis and the industry will watch this interview. But as we taper down the interview, I want to ask you perhaps a little bit of an unfair question. What's your prediction for dentistry over the next 6 years, so that when we meet again in 6 years, what you had on the list, and see how right you were? And
I would love to see. I think, and I'm really excited about the stem cell research when it comes to regenerating dental tissue. I think when I've seen it and some of the stuff I've heard, that it's. I think they're getting close. They're on the cusp of it, and that's going to be revolutionary. I mean, nothing we've created in terms of dental restorative material has come close to regenerating. And that's not true. I guess I should say it has come close to mimicking tooth structure, but nothing can be the same as general tooth structure. So the fact that one day we may be able to actually use a filling material that literally mimics dentinal tubules, just in general, in the structure across, I mean, to me, it's mind-boggling. One thing I also see too is, like you said, the standardization of technology across dentistry. I think, and I hate to bring this up as being an issue, but I remember when I was in dental school, I never really had the opportunity to access a lot of dental technology out there. Like I'd worked on an E4D scanner during undergrad. I got to dental school 4 years, never even did one CAD/CAM crown. So that to me was kind of mind-boggling, that even across America, there's not a lot of standardization in terms of the training of the dental professional regarding actual technology and access and what's even out there. So I feel like a lot of graduates are graduating a little bit behind the curve, and not all. Some schools do a great job, but I'm excited to see kind of the standardization of that technology across. So that way, as a whole, we can only advance once everyone advances. So that's one of the things I'm excited about. And I love that Henry Schein has been kind of a leader and a proponent about technology. And working with ASDA, one of the things we're working on is like we're working actually a dental technology expo to standardize and give access to all dental students to all technologies. So someone like me who never touched a scanner will get an opportunity to touch it. And companies like you guys, again, we love, and I've already been talking to some of your team on the national level and getting you guys involved, coming in as the leaders and showing them, a school that may not have access to some of the stuff out there, say, hey, well, we'll teach you. We'll show you what's out there. So when you graduate, you can continue to advance on technology. Because as a whole, once we get faster and more efficient, it'll eventually become more affordable.
And then more people are going to go to the dentist for the same money we're spending. So we worked with the National Prosthetic Association, I forget the name, on developing a curriculum that was to be adopted by deans in 2019. It was adopted so that every dental school had agreed to a similar curriculum for digital dentistry. I think those kinds of things will advance digital dentistry and the digitalization of the entire healthcare continuum. Because once you are digitalizing dentistry and you're digitalizing medicine, it'll come together if, by the way, people want it. Because there are still providers of software that don't want to connect to other software.
I know, I've lived it. I know what you're talking about exactly, and I think that's something we also have to work past, the education that it's okay to change. It's okay to reach out to what's new. It's ultimately what's best for the patient, and what's best for the patient is what's out there. Then we need to bite our pride a bit and realize that it's okay to change.
And it's very important to have open architecture and interoperability. Those are the things that are that, you know, if you think about the railroad, if everybody kept their own gauges, we wouldn't have a national railroad system, and
exactly,
we wouldn't be able to move stuff across the country. And you know, in every part of commerce, you need some form of standardization. You can't keep the competition out. So we've always advocated for open architecture and interoperability. So that'll be important, I think, for the future of dentistry. So, Sohaib, appreciate you spending time. I think people will enjoy this and see how somebody that was committed to organized dentistry as a student is now successfully operating in a private practice in a dream city. So I don't want to say that there are not other dream cities, because I don't want everybody to leave New York. And if you can push for that stem cell, it'd be great, because I need it for my knee, skiing, and it's just about there.
Oh, man.
My orthopedist says to wait a little bit before he puts it in.
Yeah. That's an honor to have. And I gotta say thank you so much for having me again, Stan. I mean, it's always a pleasure. 6 years has gone by fast. I can't wait to see what's going to happen in another 6 years. I always have fun with our chats between you and I, and yeah, I mean, hopefully next year I see you in 6 years, you'll be skiing, and then no noonie, nothing.
Well, I want to come out to Seattle and ski. You've got some good mountains there.
No, we do. Yeah, please come out. Let me know. We'll have you here.
So, everyone, thank you all for tuning in. Dr. Sohaib Soliman, who was president of ASDA 6 years ago. We spoke to Dr. Soliman 6 years ago about his thoughts on the profession, and now he is the profession. So thank you all for tuning in, and we look forward to having another meeting 6 years from now.
Yeah.
Thank you, everyone.